So good morning, everyone. Welcome to the Human Services Committee meeting for today, Thursday, March 17th. I am Representative Abercrombie, the co-chair of the Human Services Committee, and I'd like to welcome you all to our JF meeting. Remarks from the chair, Senator Moore.
Oh, just good morning.
Thank you, ma'am.
Thank you.
Representative Hayes.
Well, good morning. It's St. Patrick's Day. It's the only green thing I own, but you know, I thought I'd represent, even though I'm not Irish, but good morning.
Good morning. Happy St. Patrick's Day. And Senator Berthel.
Good morning, Madam Chair. Happy St. Patrick's Day to everyone, and let's get to work.
Sounds good. I know everybody's busy, so we will try and get through this as easily as possible. So I will entertain so first of all, when I entertain a motion, if you could say your name and then moved, that would be very helpful, especially because we have a new clerk. So item number 1 is SB number 284, an act increasing the age from 8 to 18 years for income eligible person to obtain medical assistance regardless of immigration status. This is a straight JF to the floor. Can I have a motion?
Rep Hughes, so moved.
Senator Moore, second. Senator Moore,
you.
second.
Thank you, Senator. Questions or comments? Seeing none?
No, hold on. We're just getting our computers.
I think they're just trying to organize for a moment, Representative. You just pause for 1 second, please.
Sure.
Thank you.
Representative Mastrofrancesco.
Thank you, Madam Chair. I apologize.
No
I'm having
problem.
a hard time finding my hand button on my computer here. So if I can, I do have a couple questions on this bill. Is this the same bill that we passed last session through you, Madam Chair?
Representative Abercrombie, do you want me to speak
Or
to
the
it?
similar? Can't hear now.
Yes, Madam Chair. Senator Moore.
Good morning. So this is not the same bill. Last year we passed the bill up to age 8. This one extends it to 19 years of age.
Okay, so this, thank you for that answer. So this bill extends it to age 18.
19.
The last bill that we passed last year, did that initiative, I think that was up to 8 years old, you said. Did that initiative begin yet?
It did not. It's scheduled
Can't hear.
to begin January 2023. And in July 1, they're waiting to hear, they did a report and they're waiting to hear from the report. But the bill we did last year is scheduled for January 2023.
2023.
I think
And do we know what the
They were
cost
doing a
is on the previous one?
No, there's a feasibility study.
I'm sorry, I can't hear you.
Can you hear me?
Yes.
Can you hear me?
No,
Can you hear me?
Yeah.
There's a feasibility study that's due July 1st.
Thank you, Senator. So is that feasibility study for this existing bill or the one that we did the last session?
It would be for the one that we did last session because we haven't passed this bill yet.
So I guess my question is, what was the cost of the one that brought it to 8 years old?
I don't think they have a cost yet because they haven't initiated yet and they haven't received the feasibility study.
Thank you for the answer, Senator. So if I'm not mistaken, last year when we passed this bill, it had to go to appropriations. And I assume appropriations has to put some sort of funding on it before it goes to the House. I guess I want to know, did that happen and what was that figure?
I don't know if it went to approach. Maybe Representative Abercrombie could help us there.
Yes, absolutely. Representative Mastrofrancesco, you're absolutely right. The bill went to appropriations and the fiscal note was about $8 million, which is all state money.
Thank you, Representative. So the fiscal note was $8 million. So, through you, Madam Chair, to the senator, the fiscal note was $8 million, but you said that there was a feasibility study going on. Can you explain that
is.
for me?
Senator Lesser?
Yes, thank you. Thank you, Madam Chair. Yeah, so just to clarify, the language, the legislation that we passed last year directed the state to cover children up through age 8. But then the question is, what happens when children turn 9? And so the feasibility study was about expanding the program to 18. And so the legislation before us would be going to do that. Obviously, getting the results of that study will help us figure out exactly how to do that. But this legislation is a vehicle for moving that concept forward, which is something we anticipated during last year's legislative session. Through you, Madam
Thank
Chair.
you, Lesser.
Thank you. So if I understand it correctly, the feasibility study will be for the ages up to 18 or 19. Is that correct? Did I hear it correctly?
Through you, Madam Chair, if I may.
Yes. Well, actually, through Representative Abercrombie is chairing. I stepped in and now you make up for it.
Okay. Thank you. Yes, through you, Madam Chair, that's my understanding.
So I guess we're somewhat putting the cart before the horse on this. And I know I was not in favor of this last year. Obviously, I have some major concerns of expanding this to 18. But if we have to do a study first and we're passing this saying that they are eligible, why can't a study just be done? Why can't this bill just be a study only? So you have your information, you know what the impact is before passing it and just raising the age to 18. That doesn't make any sense to me.
Senator Lesser?
Yes, thank you, Madam Chair. And just one point of clarification: the $8 million is absolutely the fiscal note for last year's bill. That was a 2-year fiscal note, not a 1 year. And I think that's an important point. Regarding, I don't think we would need legislation to do a study since we've already directed DSS to do the study. I think the question is now, making sure that obviously the results could be as late as July 1st, but we may get results well before then. Making sure that we're able to ensure that we don't have any loss of coverage. That a child who's 8 months and 364 days doesn't get healthcare for a day and then lose that coverage. I think that's the goal is to make sure that we have a seamless transition, and I think that's what we're hoping to do today. And obviously, that's going to take input from DSS as well as some number crunching to figure out if we can afford it.
It doesn't really answer my question. I just don't understand, why are we doing a feasibility study? Because the study is on up to age 18, correct? Why are we not doing that first before taking on this language and passing this bill today? It makes much more sense to do a study before making these decisions.
Senator Lesser?
Thank you. I agree. That's why we directed them to do the study last year. I believe the study is underway. I think prior to passage of this legislation, we will get the full feedback that study reflects to the legislature. It's my understanding that based on my conversations with OPM and the governor's office, that they're very intent on making sure that the chairs of this committee, the appropriations committee, get access to that information. So I completely concur, Representative, through you, Madam Chair.
Thank you. And through you, Madam Chair. So I guess my point is that the study is not done, and I thought I heard heard you mention that study will not be done until July. But we are out of session by May, so why can't we wait until we have that study in hands, review that, and then make a decision then? We can get called into session at any time. Through you, Madam Chair.
Senator Moore?
We could, but I imagine that we could, but we put this bill forward.
Representative Master-Francisco?
Thank you, Madam Chair. So, Senator Moore, we could. I guess the question is, why not? We haven't put the bill yet forward. We're discussing and debating on it today. The bill has not moved forward yet. It has not passed. So you said that we could, And I say we should, why not?
I don't really have a reason why not. I know we need to get this done, Senator Lesser.
Yes, thank you, Madam Chair. I would just say a couple of things. You know, there are some logistical things that need to be worked out, but my understanding of what DSS is looking to do is that they're looking to enroll children up to the day before their 9th birthday. So they're already setting up the systems to do this, but to implement the full program, they're going to need to cover children up to age 18. This gives DSS the tools to do that. Obviously, more information about other considerations will come forward. You know, July 1st is the absolute last date that we could get the study. My understanding from talking to stakeholders in the executive branches, we're going to be getting, you know, some really actionable data, you know, much sooner than that. So I think that will hopefully address your concerns, Representative. But also right now, DSS is setting up a plan to cover all children. Obviously, they only have statutory authority to cover children up to their 9th birthday, and giving them the permission to expand that and make sure that we don't have a drop of coverage. I assume you wouldn't. I don't think anybody would want to have kids covered for you know, from age 8 till age 9. That doesn't really do a whole lot. You can't get a good union job at age 9. So making sure that we don't have a drop of coverage, I think would allow DSS and also ensure, you know, seamless coverage in terms of the actual mechanism, whether we cover all children at once or whether we have a phase in. That's exactly what the feasibility study will help us figure out. And I think we really need to have DSS's expertise in conjunction with OPM to sort of figure out how to best to do that.
Representative Mastrofrancesco?
Thank you, Madam Chair. I have to disagree to the good senator. I have to disagree with you because it's not in effect now. So how do you know there's going to be a lapse? Number one, that you're asking to add on to what was passed last year that has not even gone into effect yet. And there is no lapse. It has not taken effect yet. So I don't understand that logic. Why we're even adding on to a program that has not taken effect. We don't know how it worked. We don't know the actual cost. I know that you mentioned that it was $8 million over a 2-year period, but the economy has changed. That number certainly can go up. It doesn't make any sense to me. It just seems like we're taking a bill that we did last year, take effect in 2023, and now we're just adding it. We're just expanding it. When does this particular bill take effect? Will it take effect with the one that we did last year through you, Madam Chair?
Yes, it will.
So it will take effect. So do we have an estimate of how many? Well, first, let me ask one question, is that this coverage is for minors up to age 18, regardless of immigration status, correct?
Correct.
So okay. So do we know how many children there are? And I have to go back to the first year that we passed it because it hasn't taken effect yet. So how many children or how many people did it cover on the bill up to 8 years old? And then how many is it estimated to cover up until age 19?
So I don't believe that we have that. I don't believe we have that exact number. First of all, we wouldn't have the number from 9 to 18 because we don't get a fiscal note until it comes out of the committee. Up to the age 8, Marie Grady, do you recall how many children would be covered under the up to age 8?
I don't have that information. Perhaps OLR may have it.
Jen or Mary?
No, we don't have that information.
Okay. I apologize, Representative. I don't have, unless OFA, I don't know if, and I don't see her. I know there's a lot of committees going on. I don't know if Emily is on and has that information. I don't think she is. We can get you that information, Representative. I just don't have it off the top of my head.
Thank you, Madam Chair. And not to you, but this is the committee process. This bill was passed last year, and the committee is telling me today that over a year, we do not know or have the information of how many children could be affected by this from a bill that was passed last year. Is that what I'm understanding? Is the committee has no idea?
No, that's not what I'm saying, ma'am. What I'm saying is I don't remember off the top of my head because that was last year's bill. As someone that's on appropriations, I'm working on this year. I can't always remember the numbers from a year before. So I apologize that I don't have that off the top of my head.
Madam Chair?
Yes, Representative Lesser?
Thank you, Madam Chair. And through you, if it's helpful, I do have a number of estimates that I've gotten that seem to indicate that the total number of children up until age 18 in Connecticut is approximately 13,000. Obviously, we don't know for sure, but that's from 0 until age 18. Obviously, not all will enroll, and that does not include the children who are already covered up until age 9. So we don't have solid data, but I would just underscore that without this bill, there will be children who will age out on January 2nd, and so that's why we do need to have the seamless coverage. And I just want to underscore that that sort of time-sensitive issue. Why it's important to have this ball rolling now.
Representative Master Francesco?
Thank you, Senator. So you had mentioned a seamless coverage. They have no coverage now. I don't understand that. There is no lapse because the program doesn't start until 2023. So it doesn't make any sense to me. Did you tell me that the number from up to age 18 was 13,000 people that would be affected by that? That would be possibly covered? Was it 13,000 total?
Correct,
So-
ma'am.
Madam Chair, if I may.
Excuse me, Madam Chair, that has to come from the governor's office.
Excuse me,
Point of order.
excuse me. There was a question asked. I responded to the question. The floor is now Representative Master Francesco's.
Thank you, Madam Chair. I guess I just wanted clarification if that number of 13,000 was from age 0 to age 19, complete. Through you, Madam Chair.
I thought that that Senator Lesser said it was up to age 18 was 13,000.
Okay, thank you, Madam Chair. I thought the bill said up to age 19 or anybody 19 and under. Is it up to the age of 18 on the bill or is it 19? Through you, Madam Chair.
Senator Moore?
It's 19, because that's youth. That's all youth, according to the attorneys. Maria, am I correct? It's up to 19 for youth?
It's up to 19, so technically it's 18. Anybody 19 would not be covered.
Their nine. Thank you. And that started with their 19th birthday. So this is the total. So I would assume that the committee doesn't have the numbers of the people that it could possibly cover up to age 8, but they absolutely should have some estimate as to what the ages are from 9 or 8 up until 18 or 19. How many people are there?
So I think, Representative, just for clarification, we can get you the number up to age 9, right? They're 8 years old, and at 9, they don't have coverage. I just don't remember off the top of my head. I'll apologize again that I don't have that exact number. The number that Senator Lesser is talking about is 13,000 up to their 19th birthday. I hope that's helpful.
No, thank you, Madam Chair. I understand that what was passed last year and the number that we don't have. What I'm trying to figure out is what is it after that, from ages 9 to 18 or 8 to 19? And to bring a bill to this committee without having that number, I'm not asking you for a physical note. I'm not asking you for a dollar amount. I would want to know potentially exactly how many people that this would cover. And we should have that information. It shouldn't be, we'll check it, I'll get it back to you. I mean, this is the whole committee process, and probably goes back to my point is maybe something like this should be put into a study, because you're asking us to vote on a bill that we don't have all the information on that could potentially financially impact the state of Connecticut for decades. So I guess we're looking for that number.
Representative, that was a question that you could have very easily asked at the public hearing. That's information we probably could have gotten. We can always go back and say, we should have asked this, we should have asked that. Normally the way it works for fiscal notes and for populations, especially when we're talking about serving any kind of Medicaid insurance, we don't normally get that number until after it gets out of the committee and goes to appropriations. We could have very easily asked it at the public hearing. I don't recall, and I could be wrong, there was a lot of testimony. I don't recall anybody asking the commissioner about how many, children would be served under that. So, I understand what you're saying. It's a number you would like. What I'm saying to you is we can get you that number. We just don't have it readily available right now.
Thank you, Madam Chair. So I guess my concern is that I would hope, this is a committee bill. Could have I asked that question during the public hearing? I guess I could have, but it's kind of a key element and it's very important. I would think that the committee raised this bill, that the committee would be the first thing to say as we're doing anything. Well, how many people will this affect? It's not a hard question. It's not a hard, it's just something I just think it's just common sense that we should know, because then you can always get an idea in your mind of how many people it's going to affect. It's going to go to appropriations. If it's thousands of people, then potentially the cost could be very high. And if it's a few people, then you kind of know that it's not going to be that high. So I think it's a legitimate question, and I honestly think that we should have the answer. I shouldn't have to ask it just only in a public hearing. I think the committee should know that answer. But I understand if someone can please get me that information, I would certainly appreciate it. The other question I have, again, is I just want to go back to, we have a lot of people in the state of Connecticut that don't have insurance coverage for whatever reason, and they are certainly documented. They are American citizens. I understand what the goal is here that you are trying to do. But I honestly have to say, I am not in agreement with this. I truly believe in the American system of government, that we want to help as many people as we can. And I understand that there could be children. I'm not being sensitive to that, not being unsensitive to that. But we have American citizens that are children too, that are suffering, that don't have the assistance that they need. Perhaps they fall just under that dollar amount for poverty level, and they can't afford it. And I believe that we need to be taking care of their American citizens first and foremost. And I believe that, this country is wonderful. And I'm so happy that so many people want to come to this country. But I just think that there should be a process that they should get here legally so that they can get the support and the services that they need. So I was very concerned about this bill last year when it passed. I think it's going to be a big undertaking. It's going to cost the taxpayers millions of dollars, not only for today, this is ongoing yearly, for decades. It's going to cost the taxpayers an incredible amount of money. And we don't have those figures. I understand that bills here have to go through appropriations first, and then we get it. And I understand that's the process. That's kind of backwards to me. I almost think that we should know kind of what things are going to estimate, what they're going to cost before we pass them out of committee. But I understand that's the process, and that's probably excuse me, why I'm always voting no on a lot of things, because I would like to have an idea of what they cost, and just to flag it, because I understand it has to go to appropriations, but it's just really backwards to me. But I understand. I'm going to listen to the rest of the debate today. I'm certainly not in favor of this bill, but after listening to the debate, I may have some more questions. But I appreciate your time, Representative. Thank you.
Thank you, Representative. Representative Case?
Just getting unmuted here. So thank you. So we talk about a feasibility study. The feasibility study is still going on for the last bill. Is that correct?
Yes.
So were there dollars earmarked and set aside in last year's biennium budget, or did we have to wait for that feasibility study?
Can you repeat that question?
Was there monies in the appropriations to start this January 1st within that biennium budget, or are we waiting for the feasibility study?
No, there was money put in last year's budget for this program to start January 1.
And do we happen to know how many dollars that was?
I want to say it was around $8 million, but if OFA, there's Emily. Emily Shepherd, do you by chance have the dollar amount that was in the budget for last year?
Yeah, I'm just looking it up right now. I just have it, and we put $4.1 million in FY23 to support children age 8 and under.
Representative Case?
Okay, so if we put $4.1 million in the budget starting January, so that's basically a half a year coverage, because the estimated was 8 million. What's the feasibility study for? Why couldn't it be impacted? What are we studying?
So the feasibility study was to see what it would cost to go up to 201 of the federally, the FPL, which is the federal poverty level, and to see what it would cost to go above the age 18.
So going above the age 18 to the end of your age 18, in this feasibility study, hold on a second. Somebody has a computer on. In this feasibility study, okay, it's muted. You have to shut your speaker off.
Go ahead, Representative Case.
I'm sorry.
No, that's okay.
There we go.
You were talking about the feasibility study.
Yeah, I was talking about the feasibility study. Thank you. So when we talk about the feasibility study and moving it forward, we obviously don't have a dollar amount. Will we have a dollar amount before this session, before we go to the floor with this?
So is your question, let me just repeat back what you're asking, because I want to make sure we're all on the same page. Are you asking what the dollar amount to go from age 9 to 19 will be? Yes, we will get that dollar amount once it gets out of this committee and goes to appropriations, but we will not get the dollar amount before it goes to appropriation. The feasibility study is due to this committee and appropriations by July 1st, 2022.
So the feasibility study is what finances this project.
No, I think it just gives us information to go into the future.
Okay, and I guess my concern is I'm not sure, not on appropriations. I don't know where the monies are coming from. I don't see this. I don't want to give false hope, as I didn't last year, and I voted no. And I don't have enough information. I understand that the number's been thrown out of 13,000 people would be affected. I haven't heard that from the attorneys. I've heard it from Senator Lesser, who I'm sure has been working on this. But until we get concrete information, and I can change my vote on the House floor, but I just don't see in our fiscal times right now, we should not be using federal dollars for this program, even if we have those federal dollars. And therefore there is, and I see Senator Moore shaking no, but there is no monies within this budget, from what I read, that can go forward to fund this. So with that, I'll let my other colleagues, if they would like to speak. I don't know if Senator Berthel's gone or if he's still here with us. I'll let everybody else go for it. Thank you.
So Representative Case, just for clarification, there are no federal dollars being used for this expansion. This has to be all state dollars, just for clarification. There's no ARPA being used for this. There's no Medicaid dollars being used for this. This is strictly state dollars, just for clarification. Representative Hughes?
Thank you, Madam Chair. Hey, I just wanted to say that we did get testimony about how many children this would cover, estimated during the public hearing. Also, the total and we heard lots and lots of testimony about the costs to Connecticut in the lapses and delays of care that these children are not getting. And we heard that it's costing the hospitals $700 million in uncompensated care. So we do know that delaying and denying access to healthcare for this community is already costing the state of Connecticut, and that we also heard, I believe, from DSS that there'd be a 10.2 million cost estimated for the 13,000 children to expansion. And again, we're looking at this as all these kids are going to school with, all of our kids. We heard heartbreaking testimony about the denial of access, or kids, hiding their injuries and illnesses because they know that their parents can't afford it. And I just want to say, in Connecticut, I believe there's no such thing as other people's children, and we need to take care of everybody, not just in a public health emergency, but ongoing, because it ultimately saves the state of Connecticut tax dollars. So I just wanted to state that for the record. Thank you, Madam
Thank you,
Chair.
Representative. Representative Dathan? Representative Dathan? Okay, moving on, Senator Berthel.
Good morning. Thank you, Madam Chair. I'm not sure who to address the question to, so I'll put it up through you, and then I don't know if Senator Moore or Senator Lesser would respond, but and I apologize if we heard this in the public hearing or if we discussed this before, but are there any other states in the country that are doing what we are about to vote on at this point in the committee? Are there any other states that do this type of coverage for their citizens? Through you, Madam
Yes.
Chair.
Yes, there are.
Okay, do we know who? I see a couple. I think Senator Lesser has his hand up. Maybe Madam Chair, might we allow the senator to provide some additional detail?
Sure, absolutely. Senator
Thank you.
Lesser?
Yes, thank you, Madam Chair. Offhand, through you, I know the California, Oregon, Washington, Illinois, New York. I'm sure there are others, but those just come to mind right off the top of my head. I know some of those states also provide health insurance to populations in addition to children. Yeah, so my understanding is that there are 6 states that currently do that. The District of Columbia as well.
All right, thank you, Madam Chair. And that does prompt another question for me. And I'm assuming that we probably don't have the answer, but maybe this could be part of the study that is being done at this point in time. When we look at what we are proposing to do here, it would certainly be logical for us to assume that we would possibly inspire people who live in states where this type of coverage is not provided to move to Connecticut. And I think that when we are truly examining the fiscal impact of this, we certainly can be intelligent today by saying, yes, we think we know. We heard a testimony from the commissioner on this about approximately how many individuals this coverage would apply to today in Connecticut. My concern, as any of us have, when we look at our budget process, we look at how we try to plan for the future, is that just by normal assumption, I'm going to say that this population is going to grow in Connecticut, and we're going to see and potentially once again be in a situation where we're trying to figure out how to pay for something that we thought was something today, was at some dollar amount today, and 2 years from now, we could have double the population that we need to cover under this proposal. And I'm very deeply concerned about that because, I know right now we have, we are awash, and I know Representative Abercrombie, you spoke to a moment ago that this does not include any of the ARPA money, which I think is very important for us to acknowledge and accept, because we know that that ARPA money eventually is going to go away. We'll end up with some funding cliffs that we're going to have to address. Shouldn't stop us from trying to do what we think we can do and doing what's right. Okay, but I'm concerned that this program could really blossom and burgeon into something very, very expensive for us And I'm very concerned about that. We are already, despite all the good news in Connecticut and a very healthy rainy day fund and all of this, and this isn't a finance or approach, so I won't go off the rails. We could talk about why we're in what we believe to be, I think, is kind of a false sense of security right now with respect to our budgeting. But I'm very concerned about the longer term fiscal impact. I appreciate Representative Hughes' comment regarding the cost of uncompensated care, but I think we are potentially a little short-sighted in not studying what the potential impact would be, using those 6 or 7 other states perhaps as the metric to say what was the increase in their population that they had to cover once they made this coverage available. What was the cost to them? And that should be part of our thinking. That should be part of our fiscal analysis going forward. Beyond tomorrow and next year, what's the longer term impact on the taxpayers of the state of Connecticut? And I'm not trying to be insensitive. I don't think there was anything insensitive in that at all. I just am being real. I'm being real. Thank you, Madam Chair.
Thank you, Senator. Representative Dathan.
Thank you very much, Madam Chair, and sorry I had to take an urgent phone call.
No problem.
I appreciate the dialogue and the discussion this morning. I think it's really useful. I'm going to be a yes vote on this bill because I believe that it's good policy, but I agree with my appropriations hat on that we do need to continue to look at the cost and whether we can make this fit into our available appropriations and recurring appropriations, that it's not just a one-off spend. So I think it's important if we do want to continue to learn more about this policy that we supported today in committee so that it does have the opportunity to go to the next step in the legislative process. So thank you very much, Madam Chair.
Thank you, Representative. Senator Lesser, do you have anything else?
Yes, thank you, Madam Chair. And I obviously want to associate myself with the remarks of my friend's colleague, Representative Dathan. I think is spot on. You know, we're not making a final decision right now about the fiscal side of things. What we are doing is, following on the nod that we made last year, which is what we indicated that we wanted to move to 18, but knew that, the implementation was important. The biggest single thing that we've heard from DSS is that setting up the systems for handling, processing of children without using federal funds is important and complicated. And so that's why we wanted them to examine the feasibility of doing that and doing so that's in a way that is responsible. But we're not the first state to look at this. The fact that a lot of states have already done this, these are large states that have done this, gives us an opportunity to look at the impact there to find out if Senator Berthel's concerns about interstate migration are true, if we'll see a large number of people coming out of the woodwork. Obviously, we don't have a hard number for how many kids might be out there, how many of them might be income eligible. One thing I heard from Representative Matrofrancesco earlier is making sure that we don't provide any benefit that wouldn't accrue to an American citizen. And obviously, that's something that I believe is important, and I would just underscore that this bill would simply be allowing all children in the state to receive the same benefits. No child was receiving some sort of a special benefit or additional benefits. This would be the same benefits that are currently available to American citizens and green card holders. But look, as other folks have mentioned, not passing this doesn't mean that children who are already in our state don't get sick or don't present in the emergency room. And I remember last year the debate in the state Senate. My colleagues, Senator Formica and Senator Summers, made the point of listening to the fiscal impact on small hospitals of uncompensated care. And that seemed very real. So look, we're going to have to work with DSS and OPM to figure out what's affordable, what makes sense, what's prudent. They're already well underway looking at this issue. And I think it's important to keep the conversation going. We've seen from the experience of other states that they haven't, this hasn't broken the bank, and there is no evidence of interstate migration to get a child healthcare. People are moving to states for jobs. And we would know by now if California or Oregon or Washington or New York or Illinois had seen a huge spike in migration. There have been a lot of studies looking at this. They found no evidence that any of that has happened. So I think it's the evidence right now suggests that we should move forward with this bill. I'll obviously support it. But regarding the fiscal issue, I think those are real. We want to make sure that we're not doing anything that's irresponsible. And that's a conversation that's best able to take place in the Appropriations Committee. We've gotten some testimony so far from DSS on that, as Representative Hughes pointed out, and making sure that we're drilling into the numbers and figuring out what's responsible and sustainable is important. A conversation I'm willing to take part in with any member of this committee. Thank you, Madam Chair.
Thank you, Senator. Senator Berthel?
Thank you, Madam Chair, for the second time. I appreciate Senator Lesser's comments a moment ago. If there are studies that have been conducted regarding I forget what the proper term was, in-state migration in the states that have done this, I would love to see those. I think that would be very important for the committee to see. I am not the only person that has this concern regarding people moving to Connecticut because of a program like this. So, Senator Lesser, if there is, Madam Chair, through you to Senator Lesser, if there are studies available, please, you know my email address, Matt, please send them along to me. I'd love to take a look because that is really a very big concern. So thank you, Madam Chair.
Thank you, Senator. Senator Lesser, if you could send any documentation to Cass, our clerk of Human Services, so that she could send it to everybody, that would be helpful. Representative Case?
Madam Chair, just once again doing a quick Google search, looking at New York. And New York offers it at a cost. Do these people who testified know that there is a cost, or is ours no cost?
Senator Moore? You're on mute, ma'am.
I'm sorry. Representative Case, what people are you speaking of?
No, anybody who applies for this who's undocumented, it actually, I'm reading the New York law right now to where they have the option, but there is a cost to the constituent purchasing or going for the insurance.
I don't think that's written in the bill anyplace right now, that there would be a cost to them. I haven't
So
seen
New York has a cost, and so it's not comparable to this bill.
Not that I know of. I didn't see the report from New York, and I didn't hear any type of conversation that there was a cost to the individual. I'm going to ask through Representative Abercrombie if Senator Lesser considered that in his bill, or is that any place in the bill a cost?
So I can respond to that. There is no cost sharing in this bill currently, through you. Jay, Representative Case?
Okay, so we're not comparable to the other states, because I'm looking at New York's right now, and there is a cost liability for the constituent to get insurance, regardless of immigration status. So it's not comparable to this bill. So
and I don't think the conversation was that it's comparable. I think the conversation was how many other states have coverage for undocumented. And I think that's all that Senator Lesser said was what the states were. I don't think he got into details as to how that works. All he was saying was that there are states that do offer to undocumented, just for clarification.
Okay, I thought there was a comment that there would be insurance that wouldn't cost, and I was just, honestly, I just did one, I didn't look at any of the other states, I just looked at New York, and it shows that there's a cost. I'll leave it at that, and I thank you for your time, Madam Chair.
Thank you, Representative. Any further questions or comments? So I have to tell you that for me, this is a really hard vote, and I'm going to tell you why. I'm in a unique situation because I do wear the hat of appropriations. I do wear the hat of someone that has had to make some major cuts through the years when we've had some really lean budgets that affected Husky adults, that have affected our seniors. And this is a really hard vote for me because I understand that children deserve to have insurance. I believe that they should have it, but I'm also concerned about the fact that we have residents and seniors that we have not supported and we are doing a lot in this budget, but we're still not where we need to be. We have TANF programs and SAGA programs that are supposed to help the poor, and yet we have big lapses in those dollars because we are not efficient in our programs. So I sit here and I know I'm not supposed to wear my approach hat, and I tell you that all the time, and I take that, but for me, it's a little harder because I'm the subcommittee chair of appropriations. So I will say, sitting here, that this is a very hard vote for me. I think that we should wait for the study, which comes out July 1st. I don't like the idea that the date was changed from July 1st of 2023 to January 1st, when there was an agreement for July 1st. I think that was a little unfair. I think that nobody's thinking about DSS having to put a system in place. People aren't aware that DSS's IT system cannot incorporate these children because our system is linked to the federal government for Medicaid. So they have to build a whole new platform, which they are not even sure will be ready for January 1. So for those reasons, I am going to be a no on this today. And it's a very hard vote for me. But at the end of the day, I am looking at all of the residents that we serve here in Connecticut. Seeing no further questions or comments, Madam Clerk, please call the roll.
All right, a motion has been made and seconded on agenda item number 1, SB number 284, an act increasing the age from 8 to 18 years for an income eligible person to obtain medical assistance regardless of immigration status. JF to the floor. Representative Abercrombie.
Abercrombie, no.
Senator Moore.
Moore, yes.
Sorry, can you repeat? I didn't see you on screen.
Moore, yes.
There we go. Thank you. Senator Berthel.
Good morning, Madam Chair. Senator Berthel votes no.
Sorry, can you do it one more time?
Sure. I thought I gave enough lead in into it to make sure my voice, can you see me now?
Yeah,
My
thank
vote would be negative, no.
Representative Case.
Representative Case votes no.
Senator Lesser.
Senator Lesser in the affirmative.
Representative Leeper.
Representative Leeper votes no.
All right, Senator Cabrera. Representative Butler.
Representative Butler votes yes.
Okay, Representative Cook.
Representative Cook votes no.
All righty, Representative Dathan.
Representative Dathan votes yes.
Representative Garibay.
Representative Garibay votes yes.
Representative Goupil. Representative Hughes.
Representative Hughes votes yes.
Representative Santiago.
Santiago votes yes.
Representative Stallworth. Representative Aurora. Representative Buckby.
Representative Buckby votes no.
Representative Mastro Francesco.
Representative Mastro Francesco votes no.
Representative Scott.
Representative Scott votes no.
And Representative Wood. Okay, thank you, Madam Chair.
Thank you. We will be leaving the votes open, but we will determine at the end of this hearing for how long, depending how the rest of the votes go. Moving on to item number 2, SB 191, an act concerning federally qualified health center payments and the provision of non-emergency dental services at such centers. This is a straight JF to the floor. I'll entertain a motion.
So moved, Rep. Hughes.
Second,
Second, Santiago.
it's been moved and seconded. Any questions or comments? Representative Master Francesco?
Thank you, Madam Chair. I guess I just a quick question, and I just a couple concerns I have on this. I understand the initiative, and I'm assuming we do not have the numbers of the number of people that this would impact. Do we have any idea at all? Through you, Madam Chair.
With all due respect, Representative, what this does is, this just changed the payment system for FQHCs who now submit for individual dental services. Now they will, if someone comes in and gets different services the same day, they will submit under one code. I'm not sure what your question is trying to get at, so I apologize.
No, I got it. So does this cover through federal dollars?
Part of it is federal dollars and part of it is Medicaid dollars. So all this bill does, this is an agency bill from DSS. All this does is say, hey, Kathy Abercrombie came in to get a cleaning, and while she was there, we found out she needed a filling. Now you're going to submit under one for those services instead of submitting for individual services.
Got it. Okay, that clarifies it. I was thinking it was something different, but thank you so much, Representative, for the clarification. I appreciate it.
You're welcome. Any further questions or comments? Representative Case?
Madam Chair, can we start a consent calendar?
Oh, absolutely. Are you given a motion to start a consent calendar?
I would love to start a consent calendar.
Oh, and I'll second that motion, Madam Chair.
So it's been moved by Representative Case. It's been seconded by Senator Berthel to start a consent calendar. Any opposed?
No.
Seeing none, we will start a consent calendar and we will move this first item to the consent calendar. Thank you, Representative.
Thank you, Madam Chair.
Yeah, whoops, sorry. Who?
said
Representative
thank you.
Case, sorry.
Thank you, Madam Chair.
You're welcome, Representative Case. Moving on to item number 3, SB number 192, an act concerning employment service assessment, interviews, and sanctions for temporary family assistant beneficiaries who fail to comply with employment services requirements. Straight JF to the floor. This is also a DSS bill. Any questions or comments?
So moved. Representative Butler.
Been moved by Representative Butler, second.
Second, Rep. Hughes. Are we moving this to go to the consent calendar? I'm confused.
The gun was jumped a little bit here. So Representative Case, can we move this to the consent calendar?
I raised my hand for a few questions, but yes,
I'm sorry.
I
Go
will
ahead.
move it to the consent calendar. You are right.
I apologize. Sometimes when the hand is raised, I'm not sure if it's from the time before, so I apologize. So let me just ask, are there any questions or comments? Is that a hand raised, Representative Case? Sorry.
Nope, that is a hand for number 3 to consent, Madam Chair.
Okay. Seeing no objection, item number 3 will be moved to the consent calendar. Moving on to item number 4, SB 193, an act authorizing Department of Social Services eligibility workers to administer oaths. This is a straight JF to the floor. This is also a DSS proposal. I entertain a motion.
Move it to the consent calendar, if that's okay.
And I'll second it. Rep. Butler.
No,
No.
that,
Madam
Excuse
Chair,
me.
I'll move the bill.
okay, so, excuse me, just for a moment. this motion is not to move to consent. This motion is to move the bill. From there, then we ask if this is going to be moved to the consent calendar. Just for clarification, I apologize if I wasn't clear on that. So this was moved by Representative Hughes,
Yeah.
second by Senator Berthel. Are there any questions or comments? Representative Case.
As the ranking member, I'd like to move this to the consent calendar, Madam Chair.
Any objections? Seeing none, this item number 4 will be moved to the consent calendar. Thank you. Item number 5, SB 194, an act authorizing the Department of Social Services to contract with other states. Straight JF to the floor. This is also a DSS bill. I'll entertain a motion.
So moved, Rep. Hughes.
Second.
Second, Rep. Leeper.
Been moved by Representative Hughes, second by Representative Cook. Questions or comments? Representative Master Francesco.
Thank you, Madam Chair. Just to understand this correctly. So in current law right now, the DSS, they cannot contract with another state for any services. Is that correct?
They can, but they have to do what's called a process of intermedia agreements. And by giving them the ability to do this, it's really to be able to contract with universities who have some specialties that we currently don't have in the state.
So through you, Madam Chair, would you be able to contract with universities? Can you kind of give me an example of what that would be? Or what type of services they would contract with universities?
It actually, I'm reading the report on it and it wasn't specific.
Okay. So right now, the DSS can contract with other states. Do other states also, do we know, do they contract with us as well? Do they have the same type of an agreement, do we know, or which states do?
Yes, we contract, I can give you one example. We contract with Rhode Island, which is a smaller state than us, where we do some of their eligibility for some of the programs. It's common practice across state lines.
Perfect. Thank you. I just wanted some clarification. Sounds like we can enter it through the contract and certainly have better services provided for our residents. It's always a good thing. I know we always want to keep services here in state, and sometimes we cannot do that. So I think it's a positive thing. Thank you, Madam Chair. I appreciate it.
You're welcome, Representative. Representative Case.
Madam Chair, I'd like to move this to a consent.
Seeing no objection, we will move this to the consent calendar. Thank you, Representative. Item number 6, SB 281, an act concerning penalties for unauthorized use of rate increases earmarked for staff wage enhancements at nursing home facilities. Straight JF to the floor. I'll entertain a motion.
Rep. Hughes, so moved.
Can I have a second?
Second by Rep. Cook. Santiago.
It was moved by Representative Hughes, seconded by Representative Santiago. Representative Case.
Would you be okay with moving this to consent, Madam Chair?
Seeing no objections, we will move this item to the consent calendar. Thank you, Representative. Item number 7, SB 285, an act concerning the limits in the temporary family assistance program during the state public health emergency, another DSS bill. This is a JF to the floor. I'll entertain a motion.
So moved, Rep. Santiago. Cook.
It was moved by Representative Santiago, second by Representative Cook. Any questions or comments? Representative Case? Can we move this to the consent calendar? No? Okay. So everybody understands what this legislation does, right? All this does is help DSS to streamline the process if we are in a public health emergency. Doesn't do anything else. Okay, just want to make sure everybody understands what this bill does. Seeing no questions or comments, Madam Clerk, will you please call the roll?
Just to clarify, I'm calling the roll for 285, correct?
285, yes.
Okay, thank you so much. So yes, we are on Senate Bill 285, an act concerning time limits in the temporary family assistance program during a state public health emergency. Representative Abercrombie.
Representative Abercrombie votes yes.
Senator Moore.
Senator Moore votes yes.
Sorry, one more time.
Senator Moore votes yes.
There we go. Thank you. Senator Berthel.
Senator Berthel votes no.
Representative Case.
Representative Case flags it with a no.
Senator Lesser. Representative Leeper.
Representative Leeper votes yes.
Senator Cabrera. Representative Butler.
Representative Butler votes yes.
Representative Cook.
Representative Cook votes yes.
Representative Dason.
Representative Dakin votes yes.
Representative Garibay.
Representative Garibay votes yes.
Representative Goupil. Representative Hughes.
Representative Hughes votes yes.
Representative Santiago.
Santiago votes yes.
Okay, Representative Stallworth. Representative Aurora.
Stallworth votes yes.
Oh, there we go. Thank you. Thank you, Representative Stallworth. Representative Aurora. Representative Buckby.
Representative Buckby flags with a no.
Representative Mastro Francesco.
Representative Mastro Francesco votes no.
Representative Scott.
Representative Scott votes no.
And Representative Wood. Okay, thank you, Madam Chair.
Thank you. Moving on to item number 8, SB 286, an act concerning deadlines for mandatory reporting of suspected elder abuse and penalties for failure to report. This is a JFF. To the floor, I'll entertain a motion.
Rep
Motion.
Hughes, go ahead.
More motions.
Rep
Moved by
Hughes
Senator
seconds.
Moore, second by Representative Hughes. Thank you very much. Any questions or comments? Representative Case.
How about a consent?
Sounds good. Seeing no objection, we will move this to the consent calendar. Thank you, Representative. Item number 9, SB 289, an act concerning oversight and funding of the Connecticut Fatherhood Initiative. This is a JF. To the floor. I'll entertain a motion.
Representative Butler, so moved.
Senator
Can I have
Moore
a second?
second.
Thank you. It's been moved by Representative Butler, second by Senator Moore. Any questions or comments? Representative Master Francesca.
Thank you, Madam Chair. Just a quick couple of questions on this. The program that we have running now, who is that? Is there any oversight on that program?
It's actually not a program that's in place as far, so what this bill does is, this bill puts together a actual group that will be in statutory language. Currently what we have is just, and I'll let Senator Moore, because she is part of this group, comment on it, but it's actually just like a working group that works on fatherhood initiatives.
Through you, Madam
Yes, ma'am.
Chair. Representative, it is a program right now under DSS that's been operating since 1999.
Okay, yeah, thank you. Right, and that's why I said it is a program. So is there funding that we provide? Obviously, we must provide funding to program. Can you tell me an average of what the funding is?
Senator Moore?
I can give you that. So it falls under DSS. Right now, the funding for 2019 was $310,498.
Thank you, Senator. So it's a program run through DSS and it goes out into the community, which is a good program. I'm not saying that it's not a good program at all. How many towns is this program initiated in? Is it out there in within many of our communities?
Through you, Madam Chair. So it's community-based. When I add up, there's about 12 throughout the state.
Thank you. So they're community-based. Is there one organization that is overseeing, I guess?
Yes.
The Fatherhood Initiative out of all the 12?
No, not right now.
Excuse me one moment. Representative
can't right now.
Butler, can you mute?
I'm on a meeting.
Representative Butler, can you mute, please, sir? Thank you. Senator Moore.
I'm so sorry.
That's okay. That's okay. I know we're doing multiple Zooms. Senator Moore?
Yes, through you. So it's overseen by the Department of Social Services, and it's they have a council, and on the council there's some people from the executive branch, judicial, the Commission on Children and Women, Connecticut Coalition Against Domestic Violence, some of the colleges, United Way, that oversee this.
They're overseeing it. So who is the paid staff on that? Is there any paid staff on there?
There's a project director. I don't have all of the funding for everybody, but I know there's a project director. I'll just give you currently who they have. It's grown a little bit from when it started in 1999, but right now there is a administrator who's under the Office of Child Support Services, and there's another person who manages activities. There's a social service program director, 3 lead planning analysts, and a consultant in management. And it's fluctuated over the last 20 years, participants.
Thank you. And Senator Moore, is that how many years this initiative has been in place?
It went into effect in 1999. And at that time, Representative, they started with $600,000 in state dollars allocated through the legislation for piloting the program.
Thank you, Senator. So the 600,000 that it started with is you had given me a number of like 310,000 for.
Well, it's dropped down to 310,000.
Right, that's what I was questioning. That 600,000 was yearly, and then it's recently dropped down to 300,000.
Right.
Can you send me a list, or can you tell me who actually runs the program?
It falls under the Commissioner Gifford.
Right, no, but right, the ones that were on the payroll, like you said, the project director.
Oh, I don't know. I mean, it's changed
out
over the
communities.
years. I don't know who. I don't have the payroll to tell you who actually is being paid. I can tell you the titles, and I can also send you, Representative. I can send you. We just did because I'm the chair. I became the chair, I think this year. I'm a little confused for what year it was. Might have been last year. But I can send you, we did an update on the funding program that we were looking at for potential expansion. And I can send that to Cass, and she can send it out to the committee to learn more about what it's doing. I chair it with the Commissioner Gifford.
Thank you, Senator. And just one more question. Do we anticipate the funding for that to be around the same as it was in 2019? Do we anticipate any big increase in funding?
I saw they asked for, I don't have the number of what they asked for, but there was an increase in funding. Representative Abercrombie, do you know what that number was?
I don't.
But they also want, thank you, but part of this, Representative, is that they want to have the ability to go out and seek other grants, not just state dollars.
Okay, thank you. I just wanted to know what that funding is. Does this, so am I correct in saying that this bill would have to go to appropriations first because there is funding in it? For you, Madam Chair?
Well, they're not asking us to fund. They want the ability to go out and get additional funding.
Okay, I thought, because I had asked you about the 310,000. I thought you said they were asking for additional funding. I thought,
I'm not, I
Funding.
want to retract that because I'm not sure. I didn't see the budget for it, and I don't know if it showed up in appropriations, but I didn't see a dollar figure tied to this.
okay, I certainly support the program. I'm just gonna vote no today just to flag it because I just want to see what that funding is. It certainly will change when it gets to the floor, but it's a good program. I'd just like to have some numbers before me ahead of time. Thank you so much, Madam Chair. I appreciate it.
If I could, for clarification, my understanding is through the testimony of DSS, this is within their budget right now. It really is giving DSS, if we statutorily have this group, it gives them the ability to get grants and other funding opportunities. So I don't believe it'll probably go to OFA because of the fact that DSS is doing it within their budget. But you know, it'll go to the floor and be determined from there. And I hope that's helpful, Representative.
Yeah, I guess-
Representative Butler?
Okay, thank you.
Oh,
I know, I was just gonna say, hopefully maybe from now until it gets on the floor, I can get some information from DSS to see what that increase amount is. I get it, it's within their budget, but I can probably reach out to them to get that. But I'll flag it for today and by the time it gets to the floor, I have that information.
yeah, I would recommend that you reach out to Alvin Wilson, our liaison for DSS, and ask him those questions directly. That might be helpful for you.
Thanks, ma'am.
Representative Butler.
Thank you, Madam Chair. And I'd just like to say that I'm very supportive of this program and would like to see us give them all the support we can. I work in an agency where I've seen people work in this program for 6-7 years, and I could tell you how important this is because it's so easy for us to look at the people in this grouping and think of them as deadbeat dads. And what this program does is to actually help them navigate the waters to become responsible fathers. It also actually helps with the relationships between them and the mothers, whether their wives or their former girlfriends. It helps the men in their relationships in how to be more respectful and how to manage those relationships. And the result of that is the children get to see two parents that may not be living together actually be able to actually interact with each other in a respectful manner, which is very important for children. And this also serves to reduce domestic violence. So this is so very important. And excuse me. And finally, but not lastly, when we talk about young men who actually navigate the court system, the Fatherhood Initiative people work with them to actually, have as efficient a court environment as it can. Instead of one person being in and out of the courts like 10 different occasions over a year's time, the fatherhood people work with them to actually efficiently go through that and maybe only go through once or twice and actually settle this situation. So it will help make some room in the court system for other more important things. So for all those reasons, I'm supporting this, and I hope everybody else will, because instead of looking at these young men as deadbeat dads, let's help them become responsible fathers. Thank you very much, Madam Chair.
Thank you, Representative. I love your passion on this. Representative Case? You have your hand up, sir?
Yes, I'm just trying to unmute. So there you go. Hey, so is this program run through New Opportunities? I was just reading some of the stuff on DSS. Do we fund it to New Opportunities to run this program?
It's not run through. It is one of the partners through you, Madam Chair.
Representative Case?
I'm sorry, I didn't hear that.
It's not run through, it's a council, right? And they have partners, right? And they have a fiduciary. I think it's one of the CAPCA agencies. I'm not sure who's the fiduciary. But it's a council and other people are under a part of it. At the end of the day, it's DSS that oversees it.
Representative Case?
Madam Chair, would you mind if we put this on consent?
I'm sure Senator Moore would and Representative Butler would be so grateful. Seeing no objection, we will move this to the consent calendar. Item number 10, House Bill 5332, an act prohibiting home care agency contracts that penalize clients for directly hiring agency staff. This is a JFS to the floor. I'll entertain a motion.
Rep
Motion.
Hughes, so moved and
Moved by Hughes,
Seconded, Rep.
seconded
Leeper.
by Representative Leeper. Thank you very much. Questions? Representative Master Francesca.
Thank you, Madam Chair. A couple questions I have on this one here. I apologize. My computer is a little messed up here. Okay. I guess my question is, to the proponent, what is the purpose of this bill?
The purpose of this bill is to prohibit home care agencies by having a non-compete clause in their contracts with the clients that they contract with.
Thank you, Madam Chair. So I understand, and I remember going through talking about this when we were during the public hearing. I guess my question is do we know, so the home care agency has an employee that works for them. They go out and work for the client and do the care for them. The home care agency trains the employee, pays them, and so forth. At that point, just so people understand it, if the client or the patient wishes to hire that caregiver directly, basically taking that caregiver away from the agency could penalize the client with a fee. Is that correct, Madam Chair?
Yes,
Okay, and we are trying to prevent that, correct?
yes.
Okay, so I'm curious, over the course of the last year or so, do we know, maybe through the Department of Consumer Protection or the state, how many families have made complaints to the state on that issue specifically, just on being charged by the agency, the home care agency, that they breached their contract? Do we have any numbers on that?
I don't have the exact numbers on that. This is a bill that came from Consumer Protection and from Aging and Disabilities, who also gets numerous complaints on this.
I don't recall. Thank you, Madam Chair. I don't recall. I'm getting an echo. I don't recall the Consumer Protection Agency submitting testimony, or if they did, I apologize. I didn't see it. I guess what I'm trying to figure out is how many complaints there have been. I don't understand the purpose of it. And this is because of the client is getting, or I guess the client is, their services are being paid through Medicaid. Is that correct?
Some
Madam
are,
Chair.
some aren't, some are private pay.
Okay, so
Let me help you here just for a moment, if you would allow me, right?
Yes.
So in 2019, these agencies, the home and community-based agencies, had non-compete clauses with their employees, right? That said, if you work for us and you leave us, you can't go and work for the client. We felt as a body that that was an unfair practice, and we prohibited it back in 2019. Now we fast forward, and now these agencies have turned around and they're not going after the workers anymore. Now they're going after the clients who have a contract with them. The reason why this bill is important, and I'm going to say it again, and I'm going to say it every time this comes up, right? This is the only workforce in human services that has a non-compete clause. This is the only workforce that we are talking low-wage workers are prohibited from moving from client to client. We don't do it in any other human services field. I understand the argument that these are businesses and small businesses, but no offense, I can go and work for McDonald's and learn a trade there and go and work at Burger King, and there's no clauses, right? We are a self-directed state for a reason, and what that means is the seniors have the ability to hire whomever they want, right? They don't have to go through an agency. They can do it privately. But I think that this bill is really important because these clients are being charged thousands of dollars in court cases, right? To be able to defend themselves, to be able to hire whom they want. Representative Master Francesco?
Thank you, Madam Chair. So I understand your concern. And that you were saying that there's no non-compete just in this agency, but there are non-compete clauses in the world, in many private businesses. They still are private businesses. I understand it's through human services, and there is, they are more and more trying to regulate that industry, which is very concerning for me because we already have a shortage of home care workers. There is a shortage in nursing homes. There's I guess a conflict, or I guess there's a divide really between the agencies and the state agencies. There's always a risk to the elderly client when there's a shortage, which really concerns me. And it's seriously an impact on the small business. And I think, and I've mentioned this when we were talking about it in, I believe, the public hearing where we're trying to bring this out to raise the bill, is that these are private agencies and they certainly have a right to protect their investment. So they've spent a lot of money investing in their employees, which I totally understand and get, but they don't prevent, from the testimony that I've heard, you can have a home care worker work for you and they don't prevent them from going to work another job, another side job with another agency. They are not preventing them from doing that at all. They're allowing them, look, like you just said, you work at McDonald's? Yes, but you also work at Burger King at night. Maybe 2 days a week you work at McDonald's, 2 days a week you work at Burger King. They're not preventing it. So it doesn't make any sense to me why we would stop, first of all, the non-compete. Secondly, which is very, very concerning to me, is that there's a private contracts with the client and the home care agency. And I truly believe in my heart, the state of Connecticut has no business getting involved. I understand what your concern is, that this is the only business within the Human Services Department that allows that, that allows that, but it's wrong. It's just wrong on my end. People have choices, they can make their own decisions. And that's why I was concerned. I was questioning how many complaints there actually were with the Department of Consumer Protection. It could only be a few complaints. It could be many, many complaints. I don't know. I think sometimes this legislative body hears 1 or 2 complaints about something, then we feel we need to make a law that really could hurt many other people based on that. I'm just curious, and has the committee thought of turning this into a study to really see what the impact is?
No, we don't believe that that's good policy to turn it into a study. So let me respond to a couple of your comments. Number one, this isn't about the workers. This is about the clients who are elderly people. Let's remember this. These are elderly people that cannot live on their own, who are being asked to sign contracts. And a lot of times they don't even know there's a non-compete clause in there. And what happens is, and you heard the testimony of a woman that said this, that after their contract was done and their long-term insurance covered the benefits, they tried to hire that employee at a lower rate because that employee had been taking care of their father for 4 years. Come to find out, they had signed a contract that had a non-compete clause in it, and now that agency is coming after them for a fine of $10,000 plus some fees for the attorney. There are you're absolutely right, Representative. There are job classifications that have non-compete clauses, But let's remember who we're talking about. We're talking about a very high-skilled workforce, which is very competitive. We're talking about people that make hundreds of thousands of dollars, and that's why they're at high demand, and that's why they do not compete clauses. We're not talking about a senior citizen on a fixed income, right, who signs a contract to get help in their home, and some of these people have cognitive issues that sometimes don't even understand that's in there until after the fact. So let's just put into context the population that we're talking about here.
I understand, Madam Chair, but I want to put into context one other thing. Somebody that is, has an elderly that has cognitive issues, I'm assuming if that is the case, they did not get on the phone alone and make a phone call. I would assume they would have had some help, maybe through a family member to find some care. Because if that is the case, that's concerning, but you are assuming that all of the residents, all of the elderly, they're in bad physical condition, they have cognitive issues, and they cannot make that decision for themselves. I'm assuming at some point a family member had stepped in and contacted the agency. Would you agree?
And with all due respect, you're assuming that seniors that want to live at home have family members to support them. A lot of them don't, because if they did, they probably wouldn't need someone to come in and also help them. So I guess we're both looking at it from a different lens.
I agree, and I think that we're both right in some cases. I think maybe both things happen, but again, they are still private contracts with the home care agencies. Is there any reason why does the Medicaid funding that the home agency receives have anything to do with it at all?
No.
Okay, because there was a conversation during our discussion, I believe, in the public hearing at one time that it was focusing on Medicaid recipients or Medicaid agencies that receive Medicaid.
No, I think a question was asked about, does this only impact Medicaid? And the answer is no.
Okay, I have to go back. I thought the conversation was different. Shouldn't this type of a bill go to the Labor Committee? Because we are dealing with a labor issue, because I understand that it affects the client is the one that's being punished to pay, but they are actually hiring somebody. So with that in mind, would this bill not go to labor?
I think it's going to go to the floor, and then from there they will decide, but I don't believe it is, because this isn't about the worker. Remember that. This contract is not with the worker. This contract is with the client who is looking for someone to help them. So there's no labor involved with that aspect of it. It's a contract between the agency and the client.
Well, I understand that, and I understand the impact on this particular bill, but it somewhat does have to do with labor because that client is hiring somebody privately. So
they're not hiring them private. They're not hiring them privately. They're hiring them through an agency. The agency is the employer, so there's no labor issue involved.
Correct. I understand. Again, we can agree to disagree. We have a different philosophy, but I do believe that these are private contracts. And I'm concerned that the home care agency industry is struggling. We keep putting restrictions on them. And I believe truly that people should make their own individual choices. I understand that there are some people that cannot do that. I truly understand. I would be an idiot if I didn't. I do. And they should be provided services and help. But these are private contracts between the home care agency and the client. And
I think where we differ, and I believe where we differ is I believe this is a consumer protection bill.
Understood. I would love to find out how many people have called the consumer protection and made complaints on this, and how many.
And you could actually call News Junkie, because they did an article on this, because they were appalled when they looked at the court cases of how many people are being sued under this. So there is documentation out there.
I guess it's like any contract that you sign with any service provider that you may hire. There's going to be lawsuits, but I understand. Thank you, Madam Chair.
You're welcome, Representative. Representative Buckby.
Morning, Madam Chair.
Good morning.
It's this is one of those topics that's come up a couple of times. We saw it last year in commerce came up from the other side of this. So it's something I got myself a little, my feet a little soaked into a little bit more in this from the other side. And the biggest concern I had was when we're talking about those who need that assistance, those elderly folks who need someone looking after them, a lot of times they tie in with an individual, regardless of who trained them or how many years they've been doing it or who trained them in general. I know for me, if I were to say this is a family member of mine, I want them to work with someone who's comfortable with my family member, right? I don't want them to be sending someone new in every week. You find a connection with someone, and that really isn't, it goes beyond the company who assigned someone to that job or who might have trained them. So I didn't want to see the individuals who are getting the services they need get handcuffed and not be able to keep someone on board who is helping them and their family. So I was butting heads a little bit with the other side of this too, and those who gave testimony in opposition of this bill. And I had to reread it a couple times because it kept throwing me off that which side of this and how does this whole thing work. But I think the critical piece is that that client needs to have the opportunity to move to who they feel is best fit for them. I don't think it, and I know the argument has come back that, well, we've trained this person to go there. And in using the other analogies used today about flipping burgers, well, you're trained to flip burgers somewhere, it doesn't mean that 20 years later, that company still has the right to your opportunities or where you're going to work just because you learned to flip burgers at one place a long time ago, or because they helped you find a place to flip burgers. Taking that more importantly to care of, especially with the elderly, that's a huge concern. And I think this is certainly helpful for those clients who need the assistance to be able to have that flexibility. And I think it does help those people who are caring for them to have the flexibility to move to different clients and to different organizations, which really now challenges that provider, that company who asked someone to sign a contract. It now holds their feet to the fire to be a better employer as well. The people I heard that were leaving because they might not have gotten as good a pay. They might have a better benefit package. They might have better hours, whatever it might be. So I think this is exactly the direction I was hoping this would go compared to what we saw last year in different committees where it was going to go elsewhere and stand by the corporation who are saying, hey, we signed a contract with this guy. He's got to stay with us. And if that person's not happy, they're not happy. If we can't take care of our elderly, especially in that regard, then we're doing something really wrong. So I will be supporting this bill. And I thank you for just a couple of moments, Madam Chair.
Thank you, Representative. Thank you for your thoughtful comments also. We do appreciate it. Representative Case.
Well, you never like my thoughtful comments. Hey,
Say something, I'll give you kudos.
Hey, you want consent? I don't know. Hey, so in talking about this, the word came out, consumer protection. Would this possibly be able to go or have to go to general law because it's consumer protection because you're changing somebody's business profile and how they do things?
No, so there was a conversation before session started with aging and disability and consumer protection. And the decision was made because of the Medicaid portion of it, that it would come through human services, just like the bill from 2019, which protected the workers, came through human services. And I think to just comment on Representative Buckby, I think the agency tried to put bills in a lot of different committees that really didn't have cognizance over this issue last year, and consumer protection, if you look at testimony, testified against those. So there was a decision made, like we do a lot of times on bills that could go through different committees, to have this bill go through human services.
Okay, I thank you, and I thank you for that explanation. And I do feel, this is a bill that not only affects our seniors and the people who get care, but I'm also concerned on the legal implications. I'm an employee who works with a company who has a no compete, and I can't go anywhere else. Well, I can go anywhere else, but I have a time frame before I can go anywhere else. So there is that leeway in there that you have a time frame before you can go anywhere else. So I want to flag this today because I think both sides have good points, and I just want to make sure that legally we're doing the right thing. and that we're not imposing on any labor laws. So thank you.
Thank you, Representative. Senator Berthel.
Hi, yes, thank you, Madam Chair. I'll be quick and be brief. I would associate my comments with those of my ranking member in the House. I'm going to flag this as a no. I actually think this is a important piece of legislation, but as we sometimes get to in our committee meetings, we are just the committee. I think that this will probably result in some very good dialogue in both chambers. And my no vote today does not mean that I do not support the overall intent of this bill, but I really want to hear what the rest of our colleagues have to say in the other chambers as well. I think we're in the right direction here. I am concerned, as Representative Mastrofrancesco spoke to, a little bit about the impact on the small businesses that are out there. So again, a flag just for today, but I appreciate the dialogue here and the good back and forth. Thank you, Madam Chair.
Thank you, Senator. Any further questions or comments? Seeing none, Madam Clerk, please call the roll.
Thank you. We are on House Bill 5332, an act prohibiting home care agency contracts that penalize clients for directly hiring agency staff. LCO number 3496, JFS to the floor. Representative Abercrombie?
Abercrombie, yes.
Senator Moore?
Moore, yes.
Sorry, Senator Moore.
Yes.
There we go. Senator Berthel?
Senator Berthel votes no with a flag.
Representative Case?
Representative Case votes no with a red flag. Or green.
Senator Lesser? Representative Leeper?
Leeper votes yes.
Senator Cabrera?
Senator Cabrera votes yes.
Representative Butler?
Representative Butler votes yes.
Representative Cook?
Representative Cook votes yes.
Representative Dason? Representative Garibay?
Representative Garibay votes yes.
Representative Goupil? Representative Hughes? Representative Santiago?
I'm sorry, Rep. Hughes votes yes.
No worries, thank you. Representative Santiago?
Santiago votes yes.
Thank you. Representative Stallworth? Representative Aurora? Representative Buckby?
Senator Buckby votes yes.
Representative Mastrofrancesco?
Representative Mastrofrancesco votes no.
Representative Scott?
Representative Scott votes yes.
And Representative Wood? Okay, thank you, Madam Chair.
Thank you. Moving on to item number 11, SB number 198, an act concerning the advisory board for the persons who are deaf, hard of hearing, or blind or deaf blind. This is a straight JF to the floor. I'll entertain a motion.
Representative Butler, so moved.
Second.
Senator Moore, seconds.
It's been moved by Representative Butler, seconded by Senator Moore. Any questions or comments? Representative Case.
Madam Chair, I'd like to entertain that we do 11 through 13 on consent, if you'd so like that.
I think I have to call each one individually and then move it to consent. Our LCO, Marie Grady. Do I have to call each one and then move them to the consent calendar?
Yes.
Okay. So,
I
seeing no
tried.
objection, we will move item number 11, SB 198, to the consent calendar. Item number 12, SB 282, an act concerning medical assistance for bariatric surgery and prescription drugs, treatment of obesity. It's a
So moved.
JFS to the floor.
Oh,
I'll
you
entertain
beat
a
me to it.
motion.
I'll second it.
I'm sorry, who moved it?
Representative Case made the motion, but since you didn't hear him, I'll make the motion and he can second it.
So Senator Buthell moved the motion, Senator Case seconded. Do we, can we move this to the, seeing no objection, we will move this to the consent calendar?
Madam Chair, I'm not a senator.
Item number 13, House Bill 5341, enact equalizer Medicaid rates for providers of inpatient mental health services in Eastern Connecticut, a JFS, to the floor. I'll entertain a motion.
Santiago, so moved.
Second.
Second.
It's been moved by Santiago, seconded by Representative Cook. I will move this to the consent calendar with no objection. Seeing none, move to consent. That concludes all the bills on our agenda today. Madam Clerk, if you could call out the consent calendar, and since this is your first time as the clerk, if you could call each item, and then we will vote at the end on the consent calendar.
Okay, thank you. Should I read off the items? Yeah.
Yes.
Okay.
You will call each one, say the bill number, and then do all of them, and then at the end, you will call the vote like we do for each bill individually.
Okay. Would you like me to say the titles as well?
Sure.
Okay. Item 2 on the agenda, SB 191, an act concerning federally qualified health center payments and the provision of non-emergency dental services at such centers. Item number 3, SB 192, an act concerning employment services assessment interviews and sanctions for temporary family assistance beneficiaries who fail to comply with employment services requirements. Item number 4, SB 193, an act authorizing Department of Social Services eligibility workers to administer, administer oaths. Item number 5, SB 194, an act authorizing the Department of Social Services to contract with other states. Item number 6, SB 281, an act concerning penalties for unauthorized use of rate increases earmarked for staff wage enhancements at nursing home facilities. Item number 8, SB 286, an act concerning deadlines for mandatory reporting of suspected elder abuse and penalties for failure to report. Item number 9, SB 289, an act concerning oversight and funding of the Connecticut Fatherhood Initiative. Item number 11, SB 198, an act concerning the advisory board for persons who are deaf, hard of hearing, or deafblind. Item number 12, SB 282, an act concerning medical assistance for bariatric surgery and prescription drug treatment of obesity. And item number 13, an act equalizing Medicaid rates for providers of inpatient mental health services in Eastern Connecticut. All of those items are on the consent calendar. And I just take the roll?
Yes, ma'am.
Okay, thank you so much. All right, Representative Abercrombie.
Abercrombie, yes.
Senator Moore.
Moore votes yes.
Senator Berthel.
Senator Berthel votes yes.
Sorry, can you repeat one more time? I didn't have you on screen.
Okay, can you see me now? And great job with calling your first consent calendar. I vote
Thank
in
you.
the affirmative. You're welcome. I vote yes. Thank you.
Perfect, thank you. Representative Case.
You're on mute.
I thought you liked it that way. Representative Case votes yes.
Thank you. Senator Lesser. Representative Leeper,
Representative Leeper votes yes.
Senator Cabrera, Representative Butler,
Representative Butler votes yes.
thank you. Representative Cook,
Representative Cook votes yes.
all right, we got you. Representative Dason, Representative Garabay,
Representative Garabay votes yes.
okay. Representative Goupil, Representative Hughes,
Representative Hughes votes yes.
Representative Santiago,
Santiago votes yes.
Representative Stallworth, Representative Aurora, Representative Buckby,
Representative Buckby votes yes.
Representative Mastro Francesco,
Representative Mastro Francesco votes yes.
Representative Scott,
Representative Scott votes yes.
and Representative Wood. Okay, thank you, Madam Chair.
Thank you. Thank you, Kath. Appreciate that. So that concludes this Human Services Committee. We are going to recess this committee and leave the votes open till 2 o'clock. Representative Case, will that be sufficient for your members?
We could really do one, but if you want to push it till 2.
Let's keep it open till 2, because I know a lot of our members are on multiple meetings. So we will keep the votes open till 2 o'clock. Any other questions or comments? Seeing none, we will recess this committee meeting, and then our next committee meeting will be next Thursday. And if everything goes well, it will be our last JF meeting. With that, have a great St. Patrick's Day, everyone, and we will see you soon. Bye, guys.
Thank you.